Hello, everyone. I'm Kelly Lenvoy, and welcome to another special episode of hashtag Arthritis. Today's guest, a friend of ours from previous episodes, Dr. Karine Toupin-April, Associate Professor in the School of Rehabilitation Sciences at the University of Ottawa. And her research focus is in several areas, including chronic disease management, complementary medicine, patient-reported outcome measures, patient engagement and research, knowledge translation, and shared decision-making. Dr. Toupin-April, welcome.
Thank you. Thank you for having me.
Now, we're going to focus in one of those specialty areas today in terms of shared decision-making and talk about one of the two posters that you're presenting at the annual meeting. And this one is titled, How Are Determinants of Health Inequities Related to Decision-Making in Juvenile Idiopathic Arthritis Care, a Narrative Synthesis. Now, your work in shared decision-making is so important here because as decision-making goes, it's so complex for the more than 24,000 children living with JIA today in Canada, as you know, and for their parents, caregivers, and healthcare teams who are all involved in that decision-making process. Let's start with your research that explores factors like gender, culture, and socioeconomic status and how that affects decision-making in JIA care. Why is it so important to consider these determinants when making treatment decisions?
Yes, I think all these, there's a wide range of people now. We have people of different cultures, different socioeconomic status, different sex, gender, and I think it's really important to help them make the best treatment decisions. So you have a lot of young people with GIA, and they deserve to be able to make the best decisions possible. We were really interested in looking at these determinants of health inequities, and we wanted to see if the literature looked at these determinants and their link to decision making. So is it harder for some people to make decisions? Is it easier? Do they have different values and preferences when choosing treatments? And are we doing a good job of helping them making good decisions? And it's funny because often we talk about like treatment use, right? Oh, are you using this or using that? But we forget that before that, there's a decision-making process. And that decision-making process is very complicated. And we see it even with COVID vaccines. And we see it with like people choosing all sorts of diets, for example. It's very difficult. So there's a good way, I think there's an optimal way to make decisions. So it's called shared decision-making. So it's one of the optimal ways. And so shared decision-making would help people to make decisions, but is it happening? And is it happening with everyone? Or, for example, just people that have more education, or just people that have higher socioeconomic status. So that would be important to know as well. And just to remind, like shared decision-making, so it's a decision-making process, and it's really, healthcare providers with young people with juvenile idiopathic arthritis and their families making decisions together. And these decisions should be informed by the best, the information coming from the best scientific evidence on the different treatment options. So benefits and risk of options and characteristics of the different treatment options, as well as really clarifying their values and preferences. So what they truly think is the most important for them. So do they like to use treatments that are more natural? Do they like to go with medication? What kind of benefits and risks do they value the most? And together they make a decisions to make sure that they have the best kind of the decision that is informed by scientific evidence, but also really personalized to their own values and preferences. So I think we wanted to see, is that happening for everyone or just for a few people? And in our study, we found 15 studies only, which is not a lot. So 15 studies that actually linked these determinants to decision-making.
That's incredible work for you to do that type of review, and thank you so much for being able to share that with us. As you know, arthritis consumer experts, we spend a lot of time in the area around health inequities. And one of the things that we're going to link to at the end of this episode is a couple of national surveys that we've conducted, one on health inequities and one on health literacy. And certainly there where when we looked at sub-patient populations, particularly those living in rural remote communities and those in the BIPOC, Black, people of color, and Indigenous patient populations, there are some real serious gaps in care, which I think you're touching on, and which obviously is so much more profound when you're talking about children living with a serious chronic disease like JIA. Your findings suggest that few studies today directly link these health inequities to decision making in JIA care. What are the potential consequences of not addressing these inequities in treatment planning?
Yeah, I think it could potentially have really bad consequences. I think decision making should be optimal, because if you make a good decision that is really personalized, then it will be easier to follow your treatments, right? And it will be easier to see the benefits of these treatments. So I think there's a lot of people also stop using treatments because they're like, oh, I didn't want to use that. So I've been kind of forced to use it, and now I'm stuck with it. And some of the people, for example, with different cultural factors, with different socioeconomic status, potentially, they may not choose maybe the best options for them. It's possible. And so the decision making is kind of responsible for this problem, but you just see that they're not adhering to their treatments, right? Where they should. But maybe there's a reason for that. So it's important to know.
So this might be outside the scope of your poster presentation, but I think really important for our audience to understand. And that is the question, what can healthcare providers, policymakers, the healthcare system do to ensure that decision making, particularly in JIA care, is equitable and considers, every family's unique circumstances? What kind of actionable steps are we looking at?
Mhm. So I think there's a lot of steps that could be done. So I think one of the most important ones is probably to try to implement shared decision making. So try to bring information, evidence-based information to everyone, every person with GIA, and taking into account also all of these determinants of health inequities, right? So assessing, health literacy, assessing, trying to understand like what kind of decisions people want to make, what kind of options they want to see, how do they want to see these options, assessing their values and preferences, even if, you may assume that someone has specific needs and they want something, but it may not be the case. So you really need to assess it in a very sort of a thorough manner. You could use, there's different ways to facilitate shared decision making. You could use patient decision aids, for example. You could use decision coaching, which is a way to help people make the best decision for themselves. There's, for example, I'll give you an example of a patient decision aid for Indigenous people with rheumatoid arthritis that Cheryl Barnaby has built. And so she took another patient decision aid and she really made sure that it was really relevant to Indigenous people. So that's really important, trying to have these tools that will help, facilitate decision making in clinical practice. There's also ways to see if decision-making was optimal. So healthcare providers, after the consultation, could say, okay, I'm going to do a quick test. So for example, the SURE test, and it asks if the person is sure about the decision that they made. Did they get enough information? Are they clear about their values, preferences? So it's a 4-question test, and it's very easy. And then you could see if people actually, are they sure about the decision they made? So I think it's really, and then if they're not sure, then it's trying to get them the information, trying to, address these problems. I think in our narrative review, we found a few interesting results. So, for example, we learned that healthcare providers take into account the sociocultural context when they present treatment options to patients. So it could be good, but also you really have to ensure that you assess well what they want, right? What kind of information they want to be presented. So that's one of the findings we found. We also found that physicians, when helping patients with JIA choose a biologic treatment, they felt that the cultural differences between the healthcare provider and the family, the youth and the family, if there was a difference in cultural in culture, they often felt that it made it much more difficult for them to help them make a decision. Same thing, I think they felt the same for the insurance coverage. I think insurance coverage can definitely, it could be very difficult to manage. What they also found, so I think all of these aspects are really important to take into account when you help families make decisions for their treatments. So I think tools that would be really personalized and made for a specific population would be very good. You talked about health literacy. I think there's often like the scientific information out there is often difficult to understand. And so it needs to be very clear, concise, and to really help people make the best decisions. And I look at some of the other results we found. We found that income, parental education, race and sex and gender were not linked to the type of decision-making that people preferred. So whether, for example, they wanted to be passive or more active in decision-making. So it didn't seem to have an impact. So this could mean that really you need to see with each family what they want. So rather than going into, oh, we're going to use this and we're going to use that, it should be more about how do you want to make these decisions? And how should we communicate what kind of information you need to really help them all step of the way. So I think these are some of the things that we have to think about.
Well, yeah, I mean, you've just listed off so much for our audience to think about how it might apply to them. And we will certainly provide some links to those tools and resources that you've referred to. Once again, this is work that ACE is actively focused on, and that's why we're so excited about your presentation in Calgary, hoping to, start the conversation, elevate the level of dialogue that we're having on this very important topic. As we said, that affects 24,000 youth and children and their families across the country. It's so important, and thank you for sharing with us some of those key highlights from your presentation today, Dr. Toupin-April.
Thank you.
And thanks to everyone who has joined us today, our listening and watching audience. And we hope you can join us again soon for another episode of #CR Arthritis. Goodbye for now.